to the Regional Health Report. I'm AnnKREBS. This monthly program highlights the world-class health care we provide to you at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units. This month we're back on the road. We're thrilled to bring you the show from Fort Campbell, Kentucky. We're at Dreyer Fieldhouse, the temporary site of the Fort Campbell Wings of Liberty Museum. Fort Campbell is the home of the Screaming Eagles of the 101st Airborne Division Air Assault and Blanchfield Army Community Hospital. The division recently celebrated its 75th anniversary. We thought this would be a great time to look at the history of the 101st, as well as the outstanding care provided to the division over the years. We'll also show you the innovative care Army medicine is providing today. There's a legacy of honor and valor in the 101st Airborne Division Air Assault. From overcoming the Nazi occupation of Europe to the last 17 years of continuous conflict in both Afghanistan and Iraq, every soldier is trained to provide care to the wounded. But the level of life-saving care provided by the Army medic is integral to combat units.
As we prepare to deploy for combat, we're absolutely dependent on BOC and its medical professionals prepare us both prior to deploying, throughout the deployment, they're part of our formation, then upon redeployment. And then while we're deployed and throughout the entire time frame, BOC, they don't take care of just the soldiers, both the physical and the behavioral aspect, they also embrace and take care of our families.
Blanchfield Army Community Hospital cares for more than 73,000 enrolled soldiers, retirees, and their family members receiving primary care.
Well, number one, we exist for the warfighter. That's our number one priority in maintaining their readiness. But there continues to be changes. We have a lot of technology that we continue to bring on board in advancing the medicine that we're providing. The future is bright as far as continuing with the technology advances and implementing those into the hospital. One significant change that we've piloted here at Fort Campbell is virtual health. And we continue to expand that to other facilities across Army medicine, and we think that's only going to increase capability throughout Army medicine. When the hospital started off here at Fort Campbell back in 1942, it was a 2,100-bed facility. And so today we're a 39-bed facility, so we've certainly have downsized our inpatient capability, but that also comes with a lot of advances in medicine and technology that we have today.
The current hospital at Fort Campbell was built in 1982 as a replacement for the original aging medical facility. Look around and you can still find former employees and patients with memories of Fort Campbell's earliest hospital.
One hallway went north and south, and then hallways just, spurred off of it. So you walk down, 50 feet, 100 feet, whatever, there'd be two long corridors.
The old hospital was based on a World War II platform. It was 7.5 miles a quarter. It could take you a very long time to get from one area like the laboratory to, say, the OR. It could take at least a 7 to 10 minute walk. In today's modern technology, you have tube system. This laboratory is centralized to all the key points. The distance is very, very short. Our equipment is much faster.
In the past, lab tests would take 5 days to complete. Today, those same lab tests are usually done in 1 hour, and it's convenience patients are looking for.
It's a one-stop shop. You get seen by your team doctor here who refers you across the hall for the eye doctor to look at you. If you need blood work, you go downstairs to the same building, and when they prescribe your medicines, you go down to the basement and pick them up. So it's a one-stop. You can do everything all in one building.
And how about customer service? It seems like everyone knows Ida May. That's the nickname she goes by in her department.
And they always tell me, it's like, you're the reason we like coming here, because it's like when you come in, you always got a smile, you always greet us when we come in. And they're like, how you remember my name out of all the people you meet each and every day? But it's like, I got that kind of memory, and I hope it lasts, like.
Ida May has been here 28 of the hospital's 75-year history. She really does get to know the patients.
I have been with Mr. JOEMCCLURE ever since 1989. He's always been the jolly old soul that he is. He's always got a joke for you.
Then I flew with Richard Nixon, Gerald Ford, Henry Kissinger, Barry Goldwater, Hubert Humphrey, Spiro Agnew, Tip O'Neill, and Apollo 15 astronauts. Now I ride around in an old Chevrolet with my wife.
And we just bonded when I met him, like I do with the rest of them, we just bonded.
The doctors and the nurses and the med techs, all the people in this hospital have always treated us with respect and dignity, and it just made us feel good to be here.
Next, I had the chance to meet with Dr. David Twilley to discuss his experience at Blanchfield. What does it mean for you to work here?
It's really this sort of close-knit community that really loves the military, and so we love the community back too. So for me as a physician, as a primary care physician, I have the opportunity to, I always say, take care of the best patients in the entire world. Because they're patients that understand service, and when you can have a chance to get them back to the fight or to take care of their family members, and you get the, hey doc, thank you, that is worth everything. It's really why I do it.
And speaking of the community, I also talked with the mayor of nearby Hopkinsville, Kentucky. Can you tell me about your rich history here at Fort Campbell?
I sure can. Well, really for me it began on day one of my life as I was born at Fort Campbell in the building right here behind me, and certainly enjoyed the opportunities to grow up here as a Fort Campbell kid.
Did you ever receive other services here at Blanchfield?
I received multiple medical surgeries as a result of some eye injuries when I was a kid, and so I was hit with a baseball in my right eye when I was 8 years old and had 3 eye surgeries at Blanchfield Army Community Hospital, and then a year later to the day was shot in my left eye with a BB gun and had 2 eye surgeries as a result of that injury. And so no, I've spent quite a bit of time at Blanchfield Army Community Hospital and had a wonderful experience there as the nurses and the doctors and all of the staff took great care of me.
The community is so supportive here at Fort Campbell. What brings about that support?
And the entire Hopkinsville-Clarksville region certainly appreciates those who serve this great country, especially those who serve at Fort Campbell. 3 out of 4 residents of the Hopkinsville-Clarksville area are either prior military, a veteran, retiree, or a dependent of one of those. And so as a result of it, you just have people who've grown up understanding sacrifice, selfless service, the values that are represented by Fort Campbell and the soldiers and families that live here.
Great medical care is the norm here, but top-notch dental care is also essential to health readiness.
I started here as a small dental clinic assigned to the medical activity back in 1960, and from that point till 1978 we were assigned to the MEDAC with just 1-2 providers providing some basic dental care. From 1978 we went on to our own command, and today we have 5 clinics throughout Fort Campbell, and we have most, not all, dental specialties represented here. So everything from basic dentistry to state-of-the-art equipment like CAD/CAM dentistry, where we can mill a crown in 1 day. And that's usually something that took us 60-70 days. We had to outsource it to an area dental lab. So dentistry's come a long way. Our providers are state-of-the-art and on the forefront of all dental knowledge because they're involved with the community outside. So we offer pretty much anything that's offered outside the fence.
The breadth and quality of care offered at Fort Campbell ensures that the 101st is ready for the fight. So when it comes down to it, what's the significance of the 101st Airborne Division anniversary?
All of us here at Fort Campbell MEDAC and at Blanchfield Army Community Hospital just want to say a big shout out to all the Screaming Eagles out there and let them know that we're very proud to be a part of the team, and thank you for your service.
We have the elite 101st here, probably the most well-recognized division in the U.S. Army, the only air assault division in the entire world. And this division has stories from the start. First one's in Normandy, before the Normandy invasion even kicked off. Operation Market Garden, Bastogne, Battle of the Bulge, Hamburger Hill, 10-15 years of conflict, Iraq, Afghanistan. And the sacrifices these soldiers, past and present, are just unbelievable.
While the 101st Airborne Division continues to train for the next fight, Blanchfield Army Community Hospital is helping to bring new Screaming Eagles into the world. The hospital is leveraging new technology to protect the health of moms and babies.
We are here doing training today on the new Monica Novi monitor. This is a new technology. It's ECG, so it monitors uterine activity, maternal ECG, and fetal ECG. So it's another tool that we can use to monitor patients. It's an external monitor, but it's giving us the accuracy of internal monitors.
The huge thing that we have to think about is when you have patients that are in labor, about trying to keep track of baby's heart rate all the time to make sure that baby's tolerating labor. Well, with this system, when we have patients that have an increased BMI or even patients that want to have the ability to walk around the room without cords attached, the system allows them to do that. So the way that the system's designed is it picks up the baby's EKG, basically. So it picks up the wave pattern of the heart rate. And so no matter where you position the patient in the bed or if they're walking around, you're being able to pick up that baby's heart rate. So it's based off the belly button of the patient, and it's a patch that sticks on, and then there's a little pod that hooks into it, and it'll monitor mom's heart rate and baby's at the same time.
It's very beneficial for high BMI patients because adipose tissue is a conductor for ECG, so it helps us a lot with higher BMI patients that are difficult to monitor with ultrasound. So that's one of the benefits. But also patients that maybe just were difficult to monitor with FSE or with ultrasound, it's just another option that we have to monitor patients now. It gives them mobility, they can get up and move around the room, it's wireless, it's Bluetooth technology, it's waterproof, so they can get in the shower if they want to get in the shower. It's giving us a lot of benefits that we don't have when we're tied to the bed with ultrasound and TOCO. It's giving us the fetal ECG, so it is giving us a more accurate picture of what's happening in utero than what ultrasound is. It's a new technology. We've used the same technology in labor and delivery to monitor patients for roughly 40 years. So this is pretty exciting for labor and delivery. This is a very new, accurate technology that is really giving us more options in labor and delivery. Hopefully we'll cut back C-section rates. It allows the patient to get up and move around, which is what we really need when we're laboring. It helps with descent. It gives the patient more freedom, basically. They can get up and go to the bathroom if they need to without having to unplug and let the nurse know. We're still getting a good, accurate picture of the baby. So it's beneficial all around, really.
That's the Regional Health Report for September. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. We're also on the Army Medicine channel of the Defense TV app. Thanks for joining us.